Back tonight, here on In Focus, as Statistics South Africa releases its quarterly labour force survey tomorrow, there are hundreds of medical graduates who remain unemployed. This is despite a critical need for their services. A young graduate representing unemployed doctors in KwaZulu-Natal says the resolution for this lies in a budget boost. Take a look.
Dr. Sia Shozi is a lifesaver.
I remember when I was in Flagstaff, I had a patient who was in organophosphate poisoning, which basically means we need a lot of drugs to try and save their lives. They perish within 4 minutes. But I stayed close to about 15 hours trying to save their life because we had no resources. We were pumping oxygen into her lungs with no oxygen. But thankfully, God helped us to save that lady's life. She's alive today.
The 30-year-old graduated with his medical degree in 2020. It took him almost 9 years at the cost of more than 600,000 rand.
Unfortunately, I didn't get a bursary, and to this point it was really quite difficult to now not be able to get a job because now I can't buy a house, I can't buy a car, I don't have any sort of permanent employment or means for me to get permanent employment right now.
Shozi is a spokesperson for almost 200 unemployed doctors in KwaZulu-Natal. They recently protested over the government's low employment of medical graduates, despite a demand for these services.
For us, most importantly, we need doctors to be employed, and we need them to be employed in the right way. Number one, with full benefits. Number two is we do need doctors to be employed with our staff. So we do need doctors, we do need nurses, we need pharmacists, we need all these people. It's not just us, and it's more than just us, but we want to save our healthcare system. And then finally, we need resources. Too often we are left out looking for needles, having to buy needles with our own money just to be able to take bloods from patients. So for those purposes, we also do need our budget to increase dramatically for healthcare. There's just not enough money, and we need that money to be able to save people's lives.
While more jobs have been placed on offer by the government, this comes with its own challenges for the sector. Meanwhile, Shozi is attempting to open his own private practice, which has placed him in a multitude of debt, but he isn't willing to be defeated.
Hey, look, myself, I was discouraged to become a doctor. I had senior doctors tell me, no, medicine is too much work, it's too much work, but if you love it, you love it. And those people who are real doctors will tell you that our passion is unparalleled. I remember when I was in Flagstaff, I worked about 100 hours extra with no compensation simply because I wanted people to be alive. So doctors are already underpaid. Doctors right now in the system are underpaid. We already are overstretched. That's why we ask for these benefits, not because we are greedy, but because we are already overstretched. You can't take away more than what you've already taken away from us.
For Newzroom Afrika on Channel 405, I'm Karinda Jagmohan in Durban.